Okay, so today I'm going to be working with a patient who comes to me with a recent right rotator cuff repair. He's a tennis player, so we want to get him back out there as soon as possible. So today I'm just going to show him a couple of exercises that we're going to do in the acute stage, and then also the subacute and going into the chronic stages of exercise. So the first one that we're going to do is going to be under Codman's pendulum. So I'm just going to have him, you're just going to support yourself here, holding on to the couch. You're going to relax your shoulder as much as possible, and we're going to go forward and back. And we're going to allow our body weight to move our shoulder. So we don't want to actively contract it, okay? And then we'll stand up and relax. So can you go ahead and demonstrate that for me? And keep that shoulder nice and relaxed. Okay, go ahead and relax. Okay, and ideally I would have him do this for about 2 sets, 60 seconds each. Okay, so the next one that we're going to do is going to be another pendulum exercise. We're going to go laterally. So same idea, bending at the waist and allowing your body to help you move your shoulder laterally. And we don't have to go wide. We just want to get some motion going on there. Relax your shoulder so it should naturally swing. And relax. Good. Again, with that 2 sets for about 60 seconds. And the last one that we're going to do, we're going to go in circles with it. So again, just relaxing that shoulder completely and allowing your body motions to take it in a circle. And relax. Good. Okay, so you can go ahead and have a seat and I'll show you the next one. The next one is really simple. We're just going to do ball squeezes. We want to keep your grip nice and strong because I know that you're trying to get back to playing tennis, so we don't want that to be a skill that we lose. So I'll just have you hold the ball and you're just going to squeeze tightly for about a second and then relax. Make sure that you're breathing. Good. 4. Keep going. 5. We're going to do 20 of these. 6. 7. 8. 10. Good. Can you count out the last 10 for me?
11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Perfect. Okay, I'll go ahead and take that. Okay. And the last one that we're going to do that falls into the subacute stage is going to be pulleys. So I've kind of set up my own home pulley system here. Can I have you sit on the floor? We'll pretend that the floor is an actual chair. I wouldn't put the patient down here on the floor, but just for this, can you scoot up a little bit? Okay. So with this, I'm just going to have you to grab the pulleys straight out in front. Okay, and then you're going to alternate arms going up and down. And we don't have to go extremely high. We just want to create a little bit of motion in your shoulders there. Are you feeling any pain or discomfort with that?
No.
Okay. 4, 5. We're going to go to 10. 6,
7, 8, 9, 10.
Good, and relax. Okay, and then ideally I would have him do 2 sets of 10 of this. Alrighty, so we're going to move into our subacute and chronic exercises now. So patient, if I can get you to stand up for me. I'm just going to turn this camera so you guys can see us. Okay. What did I do with the towel? I had a towel, but I lost it, so we'll use this blanket instead. Okay, and so I'm gonna have you do is, I'll put this blanket here between you and the wall just for cushioning, keeping your elbow bent. Okay, I just want you to push into it. So we're gonna work on some isometric contractions. We're gonna hold for about 3 seconds and then relax. Okay, we're gonna do sets of 10. And since we are, there you go.
2, 3, 4, 5, 6, 7, 8, 9, 10.
Good, relax. Except for we're gonna hold for 3 seconds and do sets of 10. 1, 2, 3. Good, relax. Again. 1, 2, 3. Relax. Good. This must also, I don't know, he might be a stroke patient too. He's having a little bit of difficulty kind of catching on to what I'm saying. So we're gonna do it again. 1, 2, 3. Good. Relax. Okay, and with this, we would go all the way to 10, and then we would do 2 sets of this. Okay, so we'll see that we've done that, so you can relax your arm right by your side. Okay, and then the next one that we're gonna do, we're gonna stay over here by this wall. We're gonna do what's called a finger ladder. So I'm gonna have you step back just a little bit so I can demonstrate this one for you. Okay, so we're gonna step out. Okay, and ideally we would have an actual ladder that's here, but we're just gonna take our fingers and just walk it up the wall. Okay, just as high as it's gonna go without causing you any pain. Okay, and then we'll walk it back down. Okay.
Okay.
Can you go ahead and demonstrate that one for me? You can step out to the side. We want to keep your arm nice and straight. There you go. And starting low. No pain with this?
None.
Good. Awesome. And with this, I would have him perform 2 to 3 sets, going up as high as he can and relaxing in between sets. Okay, you can go ahead and relax for me. Okay, and the last one that we're going to do is scapular retraction. So I'm going to have you come back over here again. I'll hold on to this. You're just going to grab the handles of the pulleys and you're going to pull back towards you. Okay, now we're going to do both hands at the same time. There you go. Can you count for me? 2. We're going to go to 10.
3, 4, 5, 6, 7, 8, 9, 10.
Good. And relax. Okay, and then with this, I would have him perform 2 sets of 10, as long as he could tolerate it. We could also always change out the resistance of our bands that's there. That one might be a little bit more difficult, so depending on the color, I can make it easier for him. So that's what I have. Any precautions for him? I wouldn't have him do too much reaching overhead or lifting anything that's too heavy, especially not in the acute stage. And we don't really want him doing too much muscle contraction since he just had that rotator cuff, those tendons repaired. We don't want to re-injure that, those tendons. So, bye.